Okay, cellulite is a fact of life, but you can regain a smoother and sexier figure with Vela-Shape, available now at Bair Medical Spa. We're very happy to welcome back Kristie Bair, who was with us yesterday, of course. Good to see you again.
Thank you.
In your red. And Dr. Dean Bair, of course, joining us with the details about this very safe, effective, and virtually painless FDA-cleared non-surgical solution for body reshaping. Hi, Dr. Bair.
Good morning. That was a mouthful.
It was, but you know, the thing is, we all want to look good, and a lot of us, and I talked to you about this before, a lot of us are very self-conscious about cellulite. It's a reality. So what does Vela-Shape exactly do? What's the actual process?
Well, what it does is smooth and contour.
Okay.
We all know cellulite is here.
It's here to stay, usually.
And there is nothing that is going to totally get rid of cellulite. That's also the truth. But this can definitely improve the appearance. It can reduce it by up to 60%.
Up to 60%?
Right. It uses 4 things.
Okay.
Heat. 2 types of heat, suction and massage.
Okay.
And the combination of those things tightens the collagen.
Okay.
So we get tightening in this direction.
Okay.
Also the collagen in the fibrous connective tissue that tightens it this direction. So this direction, and it also shrinks the fat cells. So we get smoothing and contouring.
It's kind of like, you know, when you stand in the mirror, I know we've all done this, we stand in the mirror and we hold and we pull our leg up and goes, now if it only looked like this, and so it kind of does that, right? It just tightens it up.
Exactly.
I love that. Now, who would be a good candidate for Vela-Shape then?
People that have mild to moderate cellulite, that's perfect.
Okay.
If it's too severe,
too far
there's
gone.
nothing that helps that, honestly. And people that have very small areas of excess fat want a little reduction and a little contouring in those areas.
Well, how long would a treatment session actually last?
Depends on the size. Front of a thigh is a treatment area, and that's going to be 15 minutes. So
is that the most popular area?
Legs.
Yes.
Yes.
Absolutely. Yes.
Absolutely. Now, is it usually more hips, more inner thighs, or is it just the whole leg in general?
Usually the back of the thighs, really.
Oh, yes.
More commonly the back of the thighs. So a treatment time is going to be 15 minutes to an hour.
Okay, that's not so bad. And how many treatment sessions would be required for the optimal results?
Usually 6.
Okay.
And we try to do those twice a week or at the once a week at the longest spacing between those.
Okay.
If you start to extend it out, you don't get the same results.
So you want to keep it on a more steady basis.
Yeah,
That makes sense.
you're building up that heat, you're getting that tissue activated and shrinking it, and you want to keep that process going for a period of time.
Well, that makes sense. I mean, that way you keep with the consistency. And then after, let's say, 6 treatments, you might say, okay, I think you're good for now. And then how long would you have to wait in between before you'd come back again to do it?
Depends. If it's for body contouring, that has to be maintained pretty regularly.
Okay.
Once a month, then once every 2 months, then once every 3 to 6 months.
Okay.
The cellulite, though, what we see is people will have 6 treatments. They're good for the summer. Then they come back the next spring, have 1 or 2 just to maintain it.
Okay, well, let's see before and after photos, because then we can get an idea of how the results really work and how they actually look.
Okay.
Oh my gosh, is that really real? That's real? Oh my gosh.
That's one of our clients. Yes.
See, and that's exactly what I was talking about. When you pull your leg up, that's what it looks like, but you're doing it. That's an amazing difference. Amazing difference.
It is.
It's got to give people so much more confidence, and the belly's got to be a big area as well, huh?
This is post-baby. This is very common to tighten that back up.
Now, when you do the tummy, do you do just the upper abdomen, or do you do lower, or do you do the whole tummy?
Whole tummy.
The whole thing,
yes.
Okay. Now, if somebody comes in for a treatment, do they just say, I just want my legs, or do you do the whole body anyway? How does it normally work?
Usually areas.
Okay.
Someone comes in and they go, this is the area that really bothers me.
Okay.
And we concentrate on that.
Now the question everybody wants to know, does it hurt at all?
It's a warm treatment.
Okay.
Like you said, it uses radio frequency and light to heat the tissue, but it's in the client's control. I mean, when it gets too hot, then the technician will move to another area. So that's because you want to build that heat up.
Yeah.
And there's a temperature monitor on the handpiece. So she's watching the temperature, and when the patient says that's enough, then she moves.
Oh, that's good.
Moves
so you have
to
a
the
little
next
bit
area.
of a little bit of control over how it goes for you personally.
Oh, yes.
That's a good thing. So and then what about downtime? Is there any downtime after that or no?
Absolutely none.
Okay. That's great.
Yeah.
So you can come on your lunch break.
Oh, yeah.
Oh, yeah.
See,
Absolutely.
I'd love to hear that.
Again, the skin's going to be pink because you're using heat, but that's it.
But that's it.
But it's not burned.
I think it's a wonderful idea, and it's a good idea to really get started early on before we get into short season, because before you know it, it's time to, you know, show off your body.
That's right.
You know, there's a lot of people, maybe spring break in March, or, you know, people going away, so it's something to definitely consider. It's nice to know there's an option.
Right.
It really is.
And this is kind of the conversation we've been having. What do we do in the winter months to prepare our skin?
Exactly.
Get rid of the hair and prepare your body for the summer months.
Exactly. This is a great way to do it. So where can our viewers go for more information? Let's remind them.
They can call 881-1532 or go to bairmedicalspa.com.
Very simple. Well, it's great to have you both, as always. Great advice, and I know a lot of people will be taking it. And as you look on your screen, you can see all those details we just mentioned. Thank you both.
Thank you, and wear red tomorrow.
I will wear, yes, I will wear my red.
Tomorrow.
Go red for women noon tomorrow on the Civic Plaza, right?
Yes.
Yes. And still ahead on New Mexico Style, what to eat when you're eating for two. Stick around.